Program 34, Nurses as Assessors and Triage Nurses. So our nurses should be trained on Sbar and clinical pathways, how to assess our patients before they call a physician. So many times I see nurses call physicians and they're unprepared. And when that happens, a physician is just going to send the resident out. And that's pretty dangerous in these conditions these days. You don't know what you're sending them out to get and come back with. We want to keep them out of the hospitals at all costs, even if it wasn't during a global pandemic. When residents go out to the hospital, they're uprooted from their home. And if we can triage them in their home, it is much, much better for them and for us and for the hospitals. So making sure our nurses are trained on having the information in front of them from assessment when they call a doctor, knowing how to assess. And truly, this is why I've tried to avoid LVNs and med aids and use RNs mostly, because and some LVNs and med aids are very good at this, I should say, but the ability to, when you're passing meds on the spot, assess cognition, assess the resident's appearance, assess their articulation, assess how they're doing. It's really important. And when you're passing meds and some days you're short, you have to be very, very good at it. You have to be very keen and pick up quick on what's going on with the resident. So, you're stop and watch, you're seeing their conditions, you're knowing what's going on with them, you're knowing what their baseline is, and being able to decide what to assess and do about it right on the spot is super important. So having our nurses become more and more skilled, it's not just something I'd like to see, it's something we have to do to survive in the current climate. The hospitals are holding people less and less, and they're wanting the nursing homes to take them faster and faster. And sometimes you're getting people that aren't already completely rehabbed. They're not completely healed from what they went to the hospital for. So we have to pick up where the hospitals left off, and we have to be excellent at triaging our patients in-house. If we want to be successful at all, or have a good reputation at all, or be good at what our core job duty is nursing. So our assessing and triaging is what we do. And being able to make recommendations to doctors and give right answers to doctors about assessments it's key to our functioning as a nursing home in today's climate.